In this video, we will be discussing the early signs and symptoms of pancreatic cancer. According to the American Cancer Society, almost 62,000 people are diagnosed with pancreatic cancer every year in America. This informs us of the severity of this disease, which is increasing gradually. Pancreatic cancer is a silent disease because it is hard to spot. There is no proper screening test available to identify it in the initial stages. And unlike other cancers, it is often diagnosed when it is spread to another part of the body. That is why it is important to have an idea about the silent signs and symptoms that can help you stop cancer in the early treatable stages. Number 8, diarrhea. Diarrhea is a very general symptom of most diseases, but in the case of pancreatic cancer, it can be a warning sign if it is too severe. Severe diarrhea can be a common symptom of many pancreatic cancers. For example, a type of cancer called VIPoma is quite uncommon, but it releases a substance in the intestine called vasoactive intestinal peptide, or VIP. This substance activates the hormones of the body to send lots of water into the digestive system, which can cause watery diarrhea. Not only this, but also pancreatic cancer can cause several abdominal digestive diseases. Therefore, it is a fair chance that almost 60% of pancreatic cancer patients would have diarrhea before the diagnosis of cancer. However, it is important to know that not all diarrhea are the signs of pancreatic cancer. Only the one with recurring and chronic nature can signal pancreatic cancer. Number 7. Jaundice. Jaundice is a liver inflammatory disease that causes the accumulation of bile and ear, pain in the whole body, and turns the skin and eyes yellow. In the case of pancreatic cancer, it happens the same. Pancreatic cancer also blocks the bile duct and causes bilirubin buildup in the skin cells and tissues. Therefore, it turns the skin yellow and eyes pale. That is why experts say that people with pancreatic cancer can also have jaundice. However, it is not to say that people with jaundice will have cancer as well. Both the diseases are separate from each other, but they share some common symptoms that can correlate them in a certain way. Again, the doctor will decide what disease you may have. Number 6. Diabetes. Diabetes is a common symptom of a lot of diseases, and it is a disease itself. However, the pancreas and diabetes are very closely related to each other, especially diabetes, which appears suddenly. An abnormal change in blood sugar, which was stable a few days back, can be a sign of pancreatic cancer. Research suggests that the onset of diabetes type 2 before the age of 50 is a clear warning of an underlying health condition that can be cancer as well, because pancreatic cancer stops the insulin-producing cells of the liver and responds to insulin resistance. Not only this, but a study suggests that over 80% of pancreatic patients have type 2 diabetes already before the diagnosis. This hints at a clear relationship between both diseases, and experts are working to find more connections and solutions. Number 5. Weakness and confusion. As we have already discussed, that pancreatic cancer can cause diabetes, but there is another extreme as well. Because cancers are abnormal and abnormality is unpredictable. Contrary to the previous scenario, in this case, the insulin level increases abnormally and the blood sugar level falls. It is a pancreatic tumour state, and it can make you very weak and low on energy. A patient experiencing such a pancreatic tumour can even faint and go into a coma in extreme cases. Due to this low energy, the patient can also experience other symptoms like fast heartbeat, confusion, altered mental state, and sweating. Number 4. Satiety extremes. Since the pancreas produces enzymes for digestion, thus a malfunctioned pancreas can be damaging to the whole digestive tract. Therefore, the body fluctuates between two appetite and satiety extremes. Sometimes the abnormal pancreas produces an abnormal amount of satiety hormones and restricts the production of appetite hormones. This makes the body feel abnormally full, and in some extreme cases, the patient doesn't feel hungry for days. So a pancreatic cancer patient may feel too hungry sometimes, and on the other hand, may not experience hunger at all. Whatever the extreme is, the patient loses weight overall, because abnormal cells of the pancreas produce a mutated form of growth hormones, which does not let the body consume the energy from food. So even if you eat too much, you will still lose weight. Number 3, pains. In the case of pancreatic cancer, the pain is due to the pressing of nerves and other organs. An abnormal cell, when interceding with the surrounding cells and organs, creates a warning sensation for the brain in the form of pain. This pain may be in the pancreatic abdominal region or lower and middle back. In the case of the abdomen, the pain is caused by a blockage in the digestive tract. Not only this, patients with pancreatic cancer experience pain in the leg called DVT, or deep vein thrombosis. It happens when pancreatic cancer causes a blood clot in the root veins of the legs. This blood supply falls short, and patients experience severe throbbing pain in the lower leg. If this clot travels to the lungs, it may cause shortness of breath in case of pulmonary embolism. Number 2, itching and rashes. Pancreatic cancer comes with a lot of rashes and skin problems. However, all skin problems are not cancers, of course. The blockage of the bile duct and accumulation of bile juice in the gallbladder has several consequences, and one of them is the buildup of bilirubin in the body cells. It is a degenerative chemical that digests fats, and thus when it enters the normal body cells, it acts as a toxin and creates several allergies. The skin becomes red and tissues swell. The patient feels chronic itching all the time. Apart from that, a type of pancreatic cancer called leukocarcinoma makes the pancreas overproduce hormone abnormally called glucagon. This causes red rashes and blisters all over the body, making the skin quite miserable. Number 1, enlarged gallbladder. As we know that bile juice is stored in the gallbladder, when the bile duct is blocked due to the accumulation of waste from the pancreas or the pancreatic pressing on the common bile duct, bile juice gets trapped in the gallbladder. It results in the swelling of the gallbladder and other body tissues as well, but particularly gallbladder becomes enlarged and turgid. A physician can feel this turgidity during the examination, or you may feel tenderness in your middle abdomen by pressing. It is not very prominent, but it can be detected easily by various medical procedures. Thank you for watching, and I hope this information has been helpful to you. We wish you good health as always.